Thanks so much for that. It's a real pleasure to be here back in Florida. And let's see, here's my talk. My grandfather was a Presbyterian minister. He had a church in Tampa. And so my mom and my aunt grew up here in Florida. He was the founding minister for the first Presbyterian Church of DeBary. And then my mom went to Florida State, and my aunt went to the University of Florida. And I learned at a very young age that when that football game was on, you stayed away from the television because they were lovely ladies, but they got a little rowdy on that day. And I've had so many connections with South Florida. The Miami-Dade College is this world famous institution. Catalyst, of course, is an organization I've had many touch points with. The Health Foundation of South Florida, I think, is a cutting edge institution in the U.S. And back in the day when Roderick King was on the board, my husband, who ran an organization called Build Healthy Places Network, Roderick and Doug and I were kind of attached at the hip. And so there are a lot of good memories here. And of course, and I just wanted to give a quick shout out to Ana Castilla, who was a colleague of mine from way back at the Federal Reserve days when she was at the Atlanta Fed at the Miami branch here. And I appreciate that was those kind words about dinner, but everyone was kind of moving away from me at the table because I'm just so angry lately, and no one wants me. Do not invite me to any party because I'm just everybody's sort of frustrated with me because I'm just such a downer. And by the way, did I mention that these views are my own, and they do not represent the Federal Reserve Bank of New York or the Federal Reserve System. But the thing I'm down about is that we have so many smart people and so many resources trying to solve the problem, like housing people who are cost burdened or reducing the number of people living in poverty. And we're not really moving the needle in the way that I think we should. And so in the course of this conversation, I just want to talk to you a little bit about some thoughts that I have about how we might have a breakthrough, because I think we really need to think differently about the problem. And I'm really inspired in that effort by the observation from President Eisenhower, who said that whenever I encounter a complex problem that I can't solve, I try to make it bigger. And he says, by making it bigger, you start to see the outlines of a solution. And so that's really kind of the theme of this talk, is how we can kind of make this problem about health and housing a little bit bigger, and how we can bring in new partners, new ideas, and new resources to attack the root of the problem. This is my kind of anger was sort of encapsulated by this one event that was just a couple months ago in New York City. It was Climate Week, and Kaiser Permanente was working with the World Economic Forum, the Davos folks, and they put together a really interesting event on climate and health. And I thought, this is great. I'm super excited about this topic. I think there's a lot of crossovers between those two sectors. And so I went. It was at the Swedish consulate in Manhattan. It's very fancy, and it's like the fanciest people imaginable are speaking. And it was researchers from Harvard and from the National Academy of Medicine and big money players, the Wellcome Trust, one of the largest foundation in Europe, the Rockefeller Foundation, one of the largest foundations in the world. And they all got up there, and all of these people had sort of a very similar message, and they said, look, the problem is what we need to do, there's three things we need to do. One is we need more research. Two, we need more partnerships. And three, we need more resources. And I thought, that is unbelievable. These are really impressive people, and they are all totally wrong. That is totally wrong. We don't need any of those three things. We have plenty of money, and I'm going to get into that in the course of this conversation. We have plenty of money. There is nothing stopping us from partnering. You literally can just start handing your cards around at your table. We could do this today, here, right now. Organizations like Kaiser Permanente have been partnering with community development financial institutions like Enterprise Community Partners for a decade. They've spent $400 million on affordable housing. There's nothing stopping anybody from these partnerships. Megan Sandel, who you're going to hear from later at Boston Medical Center, has been investing with Community Reinvestment Act motivated banks and community development financial institutions, CDFIs. in affordable housing and other upstream social determinants of health through something called the Healthy Neighborhood Equity Fund for a decade. A fund that was really kind of sort of inspired by and co-founded by a friend of mine, Maggie Superchurch, who has the best name in the world, by the way, Superchurch. And I thought she was a hippie, but it turns out she's just Maggie Super married Bruce Church, so it's not that interesting, really. But so Maggie Superchurch had this really simple question: why is it that I can invest in a company that makes a pill that lowers blood pressure, but I can't invest in a neighborhood that does measurably exactly the same thing, that gets the same output, right? So how do we think differently about creating new ways of approaching the problem? And the third of those recommendations from this very esteemed group of people was more research. And for goodness sakes, we do not need any more research. That's crazy. We know what the problems are. We know how we know what the outline of the solution is, that we have to be cross-sector and we have to be place-based. Now we don't know exactly how to do it. Now that part is hard. But we don't need any more research to tell us what to do. And so when I came back to my office, and I had an analyst on my team. I said, look, could you develop it? I want some heat maps and this is for New York City, so I apologize I didn't get something that's a little bit more focused on Miami. But I said, look, I want heat maps that show areas of concern in 3 different domains. One is on economics, one is on health, and one is on climate. And I said, just make it so that the neighborhoods that are of concern light up for each one of those. And so he put this slide together in like 2 hours, by the way. And this is, I don't know how well you can see that. I'm not sure back there. I'm gonna see if I can point out some of these things. But it's life expectancy, share of residents in poverty, heat deviation. This is heat islands, places that on extreme heat days experience hotter than normal temperatures, and air pollution. And what you see is this is Manhattan here and the Bronx. These are the 2 boroughs that I'm zooming in on. And I hope I don't fall off this stage, but here's Central Park, Upper West Side, Upper East Side, Greenwich Village. These are all very well-to-do neighborhoods. And you can see that the life expectancy there is significantly higher than it is in Harlem or in the Bronx. And this is, you know, Robert Wood Johnson taught us this a long time ago. Your zip code is more important than your genetic code for your health and your life expectancy. And that is because your body is the sum record of your challenges and opportunities, and there are too few opportunities and too many challenges in this red neighborhood. But if we think about it, well, how does that manifest? So I asked him to take a look at poverty. Again, the same map. Harlem and the Bronx lining up in terms of residents living in poverty. Now, layer on that climate. Where are the hottest parts of the city? Well, it's East Harlem and the Bronx. And if you look at the air pollution in this area, it's much worse in the upper part of Harlem and the Bronx. So this is it. You don't need any more research. We know that these are the neighborhoods that we need to focus on. But the trick is how to get the partnerships to work. And that's hard, actually. And one of the ways I think, and this is how I'm gonna build this slide over the next 10 minutes or so, but I'm gonna talk a little bit about how I think, what are the components that are necessary to sort of, how do you create a cross-sector sort of intervention to attack these multiple vulnerabilities that exist, that overlap in places. So the first tool I think you need are the sinews of these partnerships, the things that keep us together, that make these partnerships work is finance, in my opinion. And so I think it's really important that we focus on financial innovation as a way to do this. This is like that Healthy Neighborhood Equity Fund where Maggie had that question about creating a fund that could lower blood pressure by improving neighborhoods, right? These are the mechanisms you use for buyers of health to pay the producers of health to come up with better outcomes. And so I think what we need to do are things like create a secondary market for community development loans, make it easier for big institutional investors to invest into neighborhoods, create a stronger partnership between community development and impact investing. I think we need new types of tools, like a Fannie Mae for climate resilient neighborhoods. And we also need to find ways to invest into nonprofits with equity. And that sounds really simple, but it's like this century-old problem. A nonprofit can't sell stock. They can't, they don't have growth capital. And so we have to find a way and there's lots of solutions to this. You could create a for-profit subsidiary that could sell stock and then help, the nonprofit parent. Or we're working on a lot of these things at the Federal Reserve Bank of New York. But there are other tools we need to work on, like what would it be like if we had a ready-to-learn at kindergarten bond, or a different way of, a friend of mine, Nathaniel Counts, he says, you can use a tax increment finance bond to improve the streetscapes and parks and whatnot, and you can pay that back by the added revenue that comes in property taxes because the enhanced value of the real estate. He says, why isn't there a TIF bond for health and wellness for a neighborhood, right? Why can't we draw a line around some of those neighborhoods that lit up, on that prior slide and say, we're going to make an investment in here, and we're going to pay for it by the improved health outcomes that we can achieve. So there are lots of ways in which we could use capital markets to bring these different sectors together to get better outcomes. But what from finance is that capital only can respond to revenue, right? So you have to find a way to create revenue. And so I think there are there's a real opportunity here, and I'm going to go through that pretty quickly. So the first is community development finance and impact investing. So the Urban Institute did a study of how much money is invested from community development, in the community development function of banks that are motivated by the Community Reinvestment Act, and it's about $400 billion a year is invested into low-income communities. And if you add on to that all the investment tax credits, low-income housing tax credit, new markets, historic preservation tax credit, all of those, and the community development block grants, et cetera, you get up to about maybe $500 billion a year invested into low-income communities. That's a pretty good sizable chunk of revenue coming into low-income communities every year. But what's frustrating about that is even though that's a fair amount of money, it only provides about one apartment, let's see, 1 in 4 people who would qualify for a rent-restricted apartment, a subsidized apartment, can get one, right? So even with that amount of financing, it's not enough to meet the need. It's only meeting 1 in 4. Now, another partner in this might be impact investing. And the Global Impact Investing Initiative, GIN, as they like to call themselves, there's another group called Tonic, which is, I don't know, it's very funny, but they do it for, but anyway, GIN says that it's about $1 trillion of impact investing dollars is invested every year. That's a global number, but most of it's invested in the United States. And it's all designed to try to create a social or environmental outcome that's positive. And so that's another $500 billion revenue coming in towards these capital markets innovations. A second sort of tranche of this, a second area of revenue, I think can come from the health sector. So last year, we spent $4.3 trillion on medical care. And I had to look these numbers up again this morning because it's just so crazy. I can't even believe them. 90% of that was spent to treat chronic disease and mental health and substance abuse issues. 90%. Most chronic disease is avoidable if you go upstream and create more neighborhoods that are opportunity rich and have more and fewer obstacles for their residents, right? So if we could just peel off a small sliver of that, like $1 trillion, by the way, I have a PhD in U.S. history, so I'm not a finance person, but $1 trillion is 1,000 billion dollars. That's a lot of money. And so let's find ways in which we can sort of peel off, invest upstream in neighborhoods to reduce that $4.3 trillion number. Now, third area, and this is we talk about climate, but one of the ways in which this area has gotten very interesting recently is through several laws that were passed and early in the Biden administration that are providing substantial amounts of investment into low-income communities. Now, it's the numbers can be measured differently, but about $500 billion is going to be invested into neighborhoods, into climate solutions, and 40% of that, through a program called Just 40, has to be invested into low-income neighborhoods. So you've got this huge slug of money that's coming through the system that's trying to find its way into neighborhoods and trying to find ways, and you can start thinking about, like, I think about how a friend of mine, Donnell Baird, has a company called Block Power. He's from Brooklyn originally. He's doing a lot of work in the Bronx, where that area where all those red lights lit up, and he is decarbonizing apartment buildings. And he's paying for that in part with money from these new programs, but then he also is getting some money from Montefiore, the hospital system in the Bronx, for avoided asthma cases, because the number of asthma cases are really dropping precipitously as he improves these buildings. So you start to see the outline of these kind of connections. By the way, he also is, because this is very technical work, to take those old boilers out and putting in these new heat pumps and other equipment, he is training a new workforce to do this work. He only hires, this guy's a genius, I mean, he's really very impressive, but he only hires people from zip codes with high levels of gun violence. So he's just triple threat, right? He is providing middle-class jobs to people who have formerly been struggling. He is improving the housing stock in the Bronx, and he is improving health, at all three simultaneously. The last sort of source of revenue comes from our anti-poverty programs. So the University of Michigan has something called the Poverty Solution Center, and they've done analysis on this. Their estimate is about $400 billion is spent on anti-poverty efforts each year. And that does not include the $800 billion we spent last year on Medicaid. Medicaid, sorry, I always get that wrong. Which is the financing for low-income and disabled people for their medical care. $400 billion, if we could just switch some of that into some kind of outcomes-based financing, so that you pay for ready-to-learn at kindergarten, not Head Start slots, or you pay for permanently housed people rather than homeless shelter beds. There's ways in which you could start thinking about how all of these sort of income revenue streams could start working together to create the resources that are necessary. And my sort of back of the envelope, if you kind of look at the numbers, it's about $4 trillion a year we could be investing into low-income communities. Now, the other piece of this, of course, is that the community has to be involved in this. None of this works without their guidance and their ownership of it. And so we have to find ways, and this is not easy, because it's hard to know, like, who's the community, how are they going to be represented, and so what we need to do is find places. I think that one way to approach this is to find some places that have a little bit of momentum. Maybe they have a community development corporation that's been a long-standing trusted partner in that place, or they have really good local government that is kind of can represent that group to help sort of start negotiating. But what I really am suggesting is, to this group, is that you find some places in the Miami-Dade area where you can bring all of these different groups together with the community and start brainstorming the way Donnell Baird has done in terms of being able to tap into all of these different sources of financing and to attack multiple problems at once, and find a way that you can build that sort of a mechanism to finally bring the massive amount of resources that we have available to us, together with the new partnerships that come up with the new business models, to build affordable housing, but to build many other sort of needs that the community has in terms of small business development or community facilities, better schools, access to transportation, the things that we know create more opportunity-rich neighborhoods and can improve health, improve the local economy, and just have a much better outcome for everybody. I think I confused everybody with that. I don't know if did that land? Did that sort of? Okay, right. I am a little ahead of schedule, but I wonder if I had a couple questions from the group, and I know you'd have to yell because there's no microphones out there. Oh, there are. Okay. And I see some runners with microphones. Just raise your hand. There's a hand here, and.
Oh, I can speak loudly. Yeah.
Okay, I can hear you.
I was wondering if Fannie Mae, Freddie Mac could provide lower interest loans to affordable housing projects. Specifically, I'm thinking of 4% tax credit finance projects, which don't get the equity impact that 9% projects get.
Yeah.
I see a great potential to do a lot more, but the problem is we can't afford the financing. So if somebody could come up with a plan and provide financing at 2% interest rate rather than 5 or 6, it would make a huge difference, and would love to see something like that come to fruition.
I think it's a great idea, and I know the European Central Bank they'll buy green bonds and things like that, so they do subsidize in some respects, not subsidize, but they sort of, they have been creating markets in the green finance space. I think Fannie Mae and Freddie Mac could do that as well. I think part of the trick here too is to sort of internalize externalities. So 40% of greenhouse gases in this country are generated from buildings, right? So if you were to start making the case that we could sort of make a big dent into that sort of that number through the housing stock, and you could talk to Fannie and Freddie about this issue, I think you could start making the case that we could use some of the climate financing to help drive down the interest rate to something that along the lines that you just described. I think that's a great idea. I see somebody standing in the back here.
Sorry. Oh. Good morning. My name is Roger Carlier. I'm with the Board of Realtors, and I'm an ambassador with the Board of Realtors, and also a member of the major investors group of the association. I mean, what you just presented, would definitely seem like, an idea that we've never seen before. Of course, what would you say would be the proper way to get the federal government, because you've listed there some items, and we're dealing with the federal government, the state government, and local government. What would you say would be, and also private entities, what would be what would you suggest would be the first approach to begin such an incredibly impacting effort? Where would one begin with the process?
Yeah, that's a great question, and I think the trick is to start locally. And what I would do, like, I sometimes fantasize about being rich someday. And if I were to, what I would do, this is my business idea to make $1 trillion, would be to create a reinsurance company that bought the downstream medical care cost risk for a community. And then I would just manage the hell out of the upstream determinants. And I'm sure I would make a fortune. But that thinking, I think, is really important. Find a neighborhood. Find a place where you can bring the players together and start building it from the bottom up. Because we can't wait for the federal government's it doesn't have the ability to, there's no program coming that's gonna do all of these things. We have to build it at the local level. And I think we have the tools we need. We have the partners we need. We have the money we need. How these pieces fit together is hard. I mean, I'll totally give you that. I mean, I wrote a book that just got published this year called The Fifth Freedom: Guaranteeing an Opportunity-Rich Childhood for All. I don't make any money off that book, which is why I feel okay shamelessly plugging it here. But in that book, what I'm trying to talk about is like a population health business model, and I really think, finding the entity that has the most to gain from improved health is your first ask. Who owns the downstream medical care cost for a place or a neighborhood or a population? Maybe it's veterans, maybe it's people with HIV, maybe it's, I don't know exactly, but I would start with somebody who, that's with like that biggest buyer of health, and then I would start adding on, I'd bring in Miami Homes for All and Catalyst and all, the community development, and say, look, how can we help make sure we're managing the upstream determinants here to really improve the health to deliver to this health provider, or to the health, the owner of the medical care cost risk. And that is how I would start to build it, from the bottom up. That's a great question, though. I think there was a question back here. Yeah.
Hi, good morning. My name is Tomas Canella. I'm with Mission United at the United Way of Miami. I actually serve in the Veterans Program there, and my question is geared towards what you just spoke about. You highlighted that community ownership is critical in order to get a buy-in from the people that live in these communities. A lot of our programs here work in these very underserved communities and work very hard to build that trust with the communities, but do you have any examples that you can cite, or information that you can share as to how we can really mend those relationships? Because whereas I, my program and my organization may be welcome in some of these communities, they're very distrusting of organizations and businesses and people that have said in the past that they're intent on serving and supporting the communities, and then they fall short or have extorted our communities. So do you have any examples that you can cite, or any information that you can share or point us to really help mend these types of gaps?
Yeah, that's a great question, and I think we have about 3 minutes left, so this may be the last one, if we might be able to get one more. And this is a great problem to have, by the way, to be squeaking tables in the back, because we need more people, more places to sit. So that's a good sign that people want to be in this room and having this conversation. So congratulations to the organizers of this event. Wow, that's great. That's great. So I think, it's really helpful to sort of, the partnerships matter in that case, so people who are trusted in the community. A model that I'm very fond of is the purpose-built community model, where they have something they call a community quarterback who helps kind of coordinate trusted entities within a neighborhood and tries to be this sort of advocate for the neighborhood, but also the curates the conversation among the different partners so that you can start building the trust, because these places have been promised things over and over again and been disappointed over and over again, and they're exhausted and they're distrustful for good reason. And so, I am getting the times up. Yeah, it says 2 more minutes here. No, okay, all right. I just got the look. There's no second guessing the look. But that would be my approach, is to sort of find somebody who can help kind of hold the conversation, that can curate the conversation. I think the Health Foundation of South Florida does a good job of this. I think the Federal Reserve does a good job of this. They could be your partner. I always say that like the community development function of the Federal Reserve is very effective because we have no money and no power. And that just means we're kind of an honest broker for bringing people together. So I would reach out to the Miami branch of the Atlanta Fed and maybe have them do some convening, and I'd be happy to put you in touch with them. So thank you all very much. I really appreciate the time today, and look forward to the rest of the conference.